Hi, I am Dr. Premkumar. I am a consultant urologist at Fortis Group of Hospitals, Bangalore. Today I will talk to you about stone disease in the urinary passage. Formation of stones in the urinary tract usually happens whenever the salt content inside the urine increases. They form a crystallization point where these salts start depositing in one part of the kidneys and form a stone. The usual location of formation of stones is inside the kidney. The patient can present with no complaints at all, and the stone is identified on an ultrasound scan or any other test. Patient can come with a pain in the loin or in the sides or in the lower back. That can be when a stone comes down from the kidneys and gets blocked in the tube called ureter, and that causes a spasm and that causes pain. Patient can also present with blood in the urine or repeated urinary tract infections. The treatment of the stone disease in the urinary tract depends on where the stone is formed and how big the stone is and how hard the stone is. There are four major techniques of treating the stone diseases. One, as we know, medications, drinking excess of water, preventing intake of salts and preventing intake of oxalates, which are more common in tomatoes, cabbages, spinach, and also taking increased intake of citrate fruits like lemon juice or oranges. They can prevent the stone to form and prevent it from becoming bigger. Surgical options of treatment is one is shockwave lithotripsy or extracorporeal shockwave lithotripsy, what we call, and that causes sound waves concentrating and focusing on a stone inside the kidney and shatter the stone into small pieces, and they come down and get into the tube and pass out in the normal passage of urine. The other way is called PCNL, where this is percutaneous nephrolithotomy, and this is by inserting a needle into the kidney through the skin and entering through that needle with a camera, going into the kidney, seeing the stone and breaking the stone into pieces either by a pneumatic lithotripter or a drilling machine, what we can simple words say, or using a laser, break it into small pieces and take it out from the kidneys. This is called PCNL. Other technique of removing the stone inside the kidney is called RIRS. So in this, we pass the camera from the urinary passage from below, go into the kidney with the flexible ureteroscope, see where the stone is with a camera, use a laser to blast or break the stone into complete powder status, and take it out whenever the pieces are little larger ones. When the patient presents with a tube blocked with a stone, the procedure we do is called ureteroscopy or URS. In this, we have a telescope which can go into the urinary passage, go into the bladder, go into the tube where the stone is blocked. We can break the stone with this instrument and take the stone out completely. Treatment of stones which are inside the bladder is either by cystolithotripsy or open technique of taking out the stone from the bladder. These are different ways of treating the stone diseases. Whenever there is a problem or you find a stone, please visit a urologist to find a best treatment or what exactly suits you. Thank you.